as that goes. But
Yeah, no problem. All right, whenever you're ready.
well, there's 3 reasons that people don't get LASIK. 1 is fear, 2 is fear, and 3 is fear. Well, actually, the third one is financing. But really, the big issue with LASIK is that people are scared, and it's normal. I mean, it's your eyes after all. And most people rate their eyes as their most valuable sense, you know. And so improving your vision like this is a very dramatic thing, and it's a very emotional thing. I like to equate it to flying. Flying's not natural. A lot of people are afraid to fly. But if you look at all the statistics, it's a lot safer than driving, you know. But most people are just very nervous about giving up control for that small period of time. So that's why it's really important for us to try to get to know our patients, to try to make them comfortable, because that helps to alleviate that fear because they just don't have control for a few seconds, you know. And really, the procedure only takes a few seconds. I mean, you're in there and it's done. You know, people are surprised at how quick it goes, and most of the time people say, "Oh, that was a little weird," or they might say, "You know, I thought it was going to be a lot worse than that," you know. And then the next day, they're just absolutely amazed by the results. You know, I think about my own experience and my own thoughts about getting LASIK. I mean, almost everybody that wears contacts or glasses in this day and age has at least given it some passing consideration. Because, you know, when you're a kid, you're put into glasses. And when I was a kid and put into glasses, that was it. There were no other options. There were glasses and contacts, but that was it. It was like a chronic health conditions. It's like saying, now you've got diabetes, you know, now you've got astigmatism, or now you've got nearsightedness, you know, and now you're stuck with this for the rest of your life. And you have to deal with it for the rest of your life. And as an adult that's been wearing glasses for 20 years, you're like, no big deal, you know. But as a kid, you know, it's used to running around and going out in the rain and playing in the snow and all that stuff. I mean, you're just not accustomed to having to wear something on your face in order to be able to see, or to poke something in your eyes to be able to see, you know. And so that was quite a shocker when I was in high school. And, you know, of course, you're just starting to notice girls and stuff like that, and you can't see them from across the room. And I think you're stuck up because you don't say hi, because you don't know who they are. You can't see their face. You can't recognize them, or friends like that. I mean, they might notice it. Maybe the same thing, you know. It's really a kind of, you know, people who don't wear glasses don't really appreciate what it's like to be stuck with these things, to be bound to them, you know. And like I said, when I first started wearing glasses, that was it. There were no other options. Now, there's another option. You can have laser vision correction. I mean, that's pretty cool. It may not be the best option for everybody. I mean, some people may be too afraid to get it done, or they don't think they can afford it, or whatnot, you know. But at least there's another option for people who don't want to have to poke something in their eye every day, or stick something on their face every day. You know, there's another option now. And so now, when a young person gets glasses, you know, if they have the same thoughts and feelings that I had about having to wear glasses, that it was kind of like a disease, now there can be a cure. You know, it's a more of a permanent solution to a permanent problem. You know, glasses and contacts are a temporary solution to that problem. So getting back to the reasons that people don't get it done, fear is the #1 reason. The best way to alleviate that fear of the process is to come in and have a consultation, determine whether you're a good candidate for the procedure. About 1 in 5 people are not even good candidates for LASIK or PRK. We do both procedures here. They're both very similar. They both have the same ultimate visual result. So, like I said, you know, 1 in 5 people are not even candidates. And so there are lots of people who, like I said, they've given it a passing thought, or they've been thinking about it for years and years and years, and they don't even know if they're a candidate. And they come in, and, you know, the worst that can happen is that maybe they're not even a candidate, and at least they find out so they can stop worrying about whether they should have it done or not, you know. The best way, like I said, is you can think about flying. If you're afraid to fly, you know, talk to other people who have flown. Go to the airport, watch the planes. They take off and they land all day long, very safely. You know, you can do that at our practice. We have a list of testimonials here. It's a huge, thick book. We've got a lot of testimonials online. These are patients that have had it done, and they share their experiences. We have a huge volume of people who have had it done in the past. You know, we've done thousands and thousands of eyes since we've been here. I have a great deal of experience with LASIK. I've done surgery with multiple different laser platforms, and I've really found the combination of lasers that really gives me the best results. And so I offer that technology exclusively to my patients. When I was part of LASIK Plus, we had done over 1 million eyes. So I have colleagues and friends at LASIK Plus still that I can talk to if I'm concerned about any issue that could be there. So I have a great deal of experience dealing with people who are interested in having LASIK, talking to LASIK patients, helping them through this process, because they reach a point where they want to get it done. They just want to get it done. Something happens, back to my own experience. I remember talking to a patient about cataract surgery, and I'm wearing my contacts at the time, and one of my contacts just dried out. And here I am, a professional, an eye surgeon, and I'm sitting there talking to a patient about eye surgery. And of course they're scared, because everybody's scared about this, it's your eyes, like I said before. Here I am, and I'm like trying not to do this. Oh my God. I'm sitting there talking to somebody, and that thing just dried out. And there's nothing that I can do, and I'm going over the risks, alternatives, and benefits of cataract surgery. And here it is, and I'm like, oh my God, is this thing gonna pop right out of my eye while I'm talking to this person? When you're in an in-depth conversation and you're really connecting with a person, you don't want to say, oh, sorry, I got to go for a minute and do this with your eye, go to the bathroom and monkey around with that stuff. I mean, you just don't want to be in that situation. Going back to my experience in high school, you could imagine talking to a good friend or somebody that you want to ask out on a date, and there you are talking to them, and all of a sudden your eye starts doing this thing, Is that going to give you the confidence that you need to ask them out on their date? So those situations are a big deal, and when you're in a situation where you're stuck with glasses or contacts, that can happen at any moment. I had experiences. I like to boat. I had experiences out on the water where I get water on my glasses, or I can't go swimming, or I jump in the water and I can't wear my glasses in the water, and I can't see. Canoe trips where glasses have been lost in the water forever, and you go out on this great adventure, and then you drive out there and you do this great canoe trip, and then you get done to the end and you lost your glasses, and now you can't drive home. You're stuck. You can't drive legally. You can't drive safely. With LASIK, in this practice, 98% of eyes come out 20/20 or better, and those eyes that don't come out 20/20 or better, virtually 100% come out 20/30 or better, which means that it's one line up from the 20/20 line. Now, most people who are coming in for LASIK, they're legally blind without their glasses. Their vision is like 2200 or 2400. They can't see anything. And it's really almost unheard of in this day and age for somebody to have laser vision correction and not be able to pass a driver's test without their glasses. And that goes for almost every LASIK practice. The technology and the experience has reached that point where we can find patients who are great candidates for the procedure and treat them and give them vision where they can go about their daily lives without glasses or contacts virtually 100% of the time. When we don't hit that mark, that's when we talk about doing an enhancement procedure. So if somebody has the procedure done and they're not completely happy with the results, or the vision or the eyes heal a little bit different than we expect them to heal, then we talk about doing an enhancement. An enhancement basically is just a retreatment of the process. People who have enhancements typically aren't wearing glasses. They're typically not dependent on glasses, but the vision isn't quite as sharp as it could be. So when that's the situation, if we can treat it safely with more laser, that's what we do. We call that an enhancement. In our practice, the enhancement rate is really 1% or less within the first year. So it's pretty rare that somebody has to have an enhancement within the first year. And for that reason, we actually offer what's called a lifetime acuity plan, so that if anybody needed an enhancement at any point in time in the future, they can get the lifetime acuity plan, and they don't have to pay for an enhancement if they were to need one in the future. I can do that because most people don't need enhancements, ever. Like I said, about 1 in 100 eyes will get an enhancement at some point in time. Across the country, it's about 3 to 5% enhancement rate. And so if you look at all the centers, all the LASIK that's being done, about maybe 1 in 20 eyes are getting enhanced. So that's still, fairly rare. We have a low enhancement rate at Keil Lasik Vision Center because we're very consistent about the way we do things. The laser is in a temperature and humidity controlled environment. I have a consistent staff that not only assists with the laser during the laser procedure, they also answer phones, they also do the workup with patients, they get to know the patients, and so they are part of the process, and so they're very highly trained. My staff is very experienced, and they're very professional. I'm very excited about my staff. I think I have the best staff in the country. And I'm not kidding, because I work with them very hard and they're very dedicated to what they do. And since they're involved in all the parts of the process, they really get to know, what causes fear in the LASIK patient and what helps to alleviate that fear and what demands that their vision, what they demand of their vision. And they, like I said, they can help in that process. So that way we do everything very consistently. We do it a lot. LASIK is virtually all we do here. LASIK and PRK. Laser vision correction is 99% of what we do here. It's almost a complete thing. And so if we don't do it well, if we don't do laser vision correction well, we're not going to be around for very long. The fact is that we've been here in this office since 2006. We started out as LASIK Plus. I took over the practice as my own private practice in 2009, and we've been growing ever since. It's been a tough economy. It's been a tough time to grow what a lot of people consider a luxury procedure, but we've been